Hi, welcome back. I'm Dr. Danso, and today we'll be talking about high blood pressure or hypertension.
Dr. Danso, what is hypertension or high blood pressure?
So, hypertension or high blood pressure is when your blood pressure is over 140/90. So, it's simply a measure of how hard the heart is working.
Who does this tend to affect?
As we get older, our blood pressure increases, so we see it more commonly in older people. We also know that certain ethnic groups are more likely to have high blood pressure, so Afro-Caribbean people and Asian community as well.
What are the risks?
So if you can imagine that your blood pressure is really high and your heart is working a little bit harder than it should to pump blood around the body. You've got tiny little vessels in your eyes, in your brain, in your lower legs. And if any of those burst or are aggravated or injured, then that can cause problems. So it can cause stroke, heart problems, peripheral vascular disease, so trouble with circulation in the legs, as well as problems with kidneys as well, because you've got tiny vessels in your kidneys as well.
What can be done to control high blood pressure or even cure it?
Okay, so I think there are lots of things that we can do before we even think about medication. So the first thing is look at what you're eating and drinking. Having a high salt diet will put your blood pressure up, as well as having a high intake of caffeine, so coffee and sort of energy drinks as well. Cutting back on those or even altogether stopping would significantly improve your blood pressure. The other thing that we know is exercise. If you increase your physical activity, your blood pressure will drop as well. So those are probably the main things that we can do to lower your blood pressure. You also mentioned about perhaps curing, and that's a really good question, because I think sometimes people don't really understand whether it's a long-term thing being on medication or not. So I think in most cases, if your blood pressure is high and you require medication, you may have to stay on that long term. However, if something drastically changes, whether it could be your diet or you lose a significant amount of weight, then your blood pressure may drop and stay down.
What are the symptoms of hypertension or high blood pressure?
That's a really good question, because in most cases there are no symptoms, which is why it's deemed as the silent killer. In some cases, however, you may experience headache or blurred vision. But as I said, it's rare to have symptoms. So the only way you'll know you have high blood pressure is if you get it checked.
How can I find out if my blood pressure is high?
So you can either check your blood pressure at home, and I've made a video that you can find on YouTube as to how you can do this correctly. Alternatively, you can attend your local chemist. Some of them provide blood pressure machines there, or you can see your GP who can check your blood pressure for you, or even your practice nurse. If you have any questions or have any of the symptoms that I've mentioned, please go and see your own GP. You can find me on Facebook, Instagram, YouTube and Twitter at The Clinic Diaries.